Side effects of radical radiotherapy. As with any treatment, radiotherapy can cause side effects. This video will explain the main side effects that you may experience and provide you with the information to enable you to sign the Royal College of Radiologists consent form and proceed with your treatment. Even with the sophisticated radiotherapy techniques that we use to treat your cancer, we are not able to ensure that the radiation only targets the cancer. Some radiation will enter the normal tissue surrounding the cancer that we are treating, and this may result in some damage to those tissues, and you may experience what we call side effects. The side effects that you may experience will depend on where your cancer is in your lungs and what normal tissues are close to it. I'm going to explain the side effects that a patient receiving radiotherapy for a lung cancer may experience. This is not individualised for you. It is extremely unlikely that you will experience all the side effects I will discuss. Someone in your team, either the consultant radiographer, or specialist trainee doctor, will be able to explain which of the side effects may apply to you and if there are any less common side effects that are not covered in this video. It's worth remembering that the radiotherapy is delivered in an arc as the treatment machine moves around your body. This means the beam is entering your body at many different locations, and so you may have something not right in a part of your chest that is different to where you think the cancer is. If you're worried about anything, then it's best to discuss with us. There may be a simple explanation which will make you feel less worried. This is all very new for you, so please don't be worried about asking us anything. Side effects associated with the radiotherapy treatment to the lung can be split into two groups: early side effects and late side effects. Firstly, early side effects are those that you may experience during treatment and shortly after completing radiotherapy, and usually resolve within a few weeks or months. Most patients may experience some mild fatigue during treatment, and some may feel a bit more than mild fatigue, such that they're having a nap during the day. This fatigue will improve after the treatment finishes, and by 4 to 6 weeks, most patients will be back to normal. If you have a hairy chest, then you may see some hair loss in the area that is being treated. Some patients may experience some mild discomfort on swallowing, especially if the cancer is close to your gullet, which we call your esophagus. This may get sorer as you proceed through treatment and can be more of a problem if you're also getting chemotherapy. We will give you medication to help improve things, and this works for the majority of patients. In a very few patients, they may struggle with eating and drinking, such that we need to admit them to hospital and give them fluids through a drip. Very rarely, we may suggest placing a feeding tube down your gullet to give you some liquid food to ensure you get adequate nutrition and fluid. This should be temporary and will be removed when things settle down. It's worth noting that you may experience some problems with your swallowing only after your treatment has finished. If that occurs, then you need to contact us using the Cancer Treatment Helpline number, as there are things that we can do to help. Occasionally, patients may feel a little bit nauseous and may be sick, though this is rare and may be related to other things in the radiotherapy treatment. We have good anti-sickness medication that we may suggest if this is a problem. Your skin around your chest may get a little red as you proceed with treatment. It may also feel a little bit itchy in places. We advise using a soft towel and not drying the area too vigorously. Patting the skin dry should be okay. Please don't apply any of your own creams to the skin and let us know, as there are creams that we can give you to help. It would be unusual to experience severe skin changes, but if you're concerned with any changes, then please discuss it with the team when you attend for treatment or phone the Cancer Treatment Helpline number. Your normal lungs are surrounding the cancer we are trying to treat, and the radiotherapy beam will need to pass through this lung tissue to get to the cancer. The lung can be sensitive to the effects of the radiation, which may result in some inflammation developing in the lung. This may result in some mild cough and shortness of breath. It might show as some mild patchy change on a chest X-ray or a CT scan. Rarely, this may start to affect your day-to-day life with increasing cough and shortness of breath. If this happens, please let us know, and we will most likely arrange some imaging tests. Sometimes we prescribe some steroids, and if we feel there may be an infection as well, start some antibiotics. It may be that you need to come into hospital to keep an eye on things. Very rarely, patients may cough up a little bit of blood. If this happens, then please let the team who's looking after you know. Again, extremely rarely, patients may experience an electrical sensation running down the back into the arms or legs. This can sometimes be brought on by bending forward. This is more likely to happen if your cancer is close to the spinal cord. It is usually nothing to worry about and will usually go away on its own accord. Please remember that as you go through treatment, you will be seen every day for treatment by the radiography team and once a week by the nursing team. So if you're experiencing any side effects, then please let us know. On completion of your treatment, some of the side effects may become more of a problem. Remember that you have access to the Cancer Treatment Helpline, which is available 24 hours a day at any time during treatment and for the first 6 weeks after you have completed your treatment. We are all experienced in dealing with side effects associated with radiotherapy treatment and will be able to help. Some side effects of treatment may develop many months or even years after radiotherapy treatment. Sometimes, if you experience significant side effects during or shortly after radiotherapy, then these may develop into side effects you'll experience in the longer term. Some patients may feel that their swallowing is a bit of a problem in the longer term. This may be felt as some pain or a sensation of food sticking. It may mean that the gullet or esophagus has become narrowed, called an esophageal stricture. This is more likely if you experienced quite severe side effects to your gullet during treatment. We will most likely consider referring you to one of the doctors who specialises in that part of your body and ask them to do a camera scope test to have a look at what the problem is. It may be that they will try and improve the narrowing by stretching the gullet. It is common that after radiotherapy to your lung cancer, the surrounding lung tissue will never go back to normal. The lung tissue will always look abnormal on an X-ray of your chest or a CT scan. For some patients, however, there can be significant reaction to the normal lung tissue after treatment. These patients may experience a dry cough, shortness of breath, and feel generally unwell. If this occurs, it is important that you let us know. We will most likely organise imaging and may suggest treatment with high-dose steroids and possibly antibiotics. If this occurs, then most patients will experience some long-term change in their breathing and feel more short of breath. It is unlikely, but it may compromise them to the point that they are breathless on minimal exertion or even at rest. It may mean that they require long-term oxygen therapy, and it may result in them being housebound. This is a very rare outcome from radiotherapy treatment. If the lung becomes significantly damaged as a result of the radiation treatment, then it may be a site that allows infections to develop more easily, and it could result in an abscess developing in the lung. It may also cause an abnormal communication to develop between the lung and your gullet or main airway. This is very rare. Your heart is in the centre of your chest and can sometimes be close to the cancer we're treating. Sometimes the lining around the heart can become inflamed that may cause some chest pain. Very rarely, and probably many years after treatment, the heart may not pump quite as well and may develop an abnormal heart rhythm. This is again rare. The bones that are close to where the cancer is will probably receive some radiation. This may result in the bones becoming weaker over many years and may result in a fracture. This can sometimes be sore and debilitating, but again is something we rarely see. Very rare side effects can occur, which will depend on if the cancer is close to these organs. Your own team will highlight these to you if they will affect you, but they include damage to the thyroid gland, such that it might not function normally, your spleen, which may mean you require supportive treatment, or some nerves called the brachial plexus, such that you may experience some altered sensation and function in your arms. Radiotherapy is very effective at dealing with cancer. However, radiation can sometimes cause cancers. The risk of a cancer developing in the area we are treating in you is very rare and takes many years, up to decades, to develop. The risk of this is outweighed by the benefit we expect you to get from the treatment we are proposing. Radiotherapy treatment is usually very safe and tolerated well, but legally we need to let you know that as with any treatment, there is a very small risk of death on radiotherapy. Thank you for listening to this video. It's worth remembering that the majority of patients tolerate radiotherapy well, and there are few serious side effects. Your team feel that radiotherapy is the best treatment option for you, and therefore the benefits of treatment clearly outweigh the risks. The whole team is very experienced in dealing with side effects. Please let us know if you are worried about anything and we will do our best to deal with it. This video will always be available for you and your family to watch back and check if you are worried about things you may be feeling. We will now be asking you to sign the consent form to allow us to proceed with your treatment. If there are any of the rare side effects that you may be more at risk of due to the position of your cancer, then your team will highlight for you.